Skin cancer is the most common type of cancer in the United States. It affects people from all walks of life and all skin tones too. So this morning, we're learning the steps you can take to prevent skin cancer and also the best ways to take care of your skin. Dr. Christina Sun is a board-certified dermatologist and fellowship-trained dermatopathologist at Dermatology Partners, Roxborough office. Dr. Sun, thank you so much for being here with us this morning.
Thank you so much for having me.
Yeah, absolutely. So first tell us why it's important for dermatologists to understand how different skin tones affect diagnosis and responses to treatment.
Yeah, different skin conditions can look really different on a variety of skin tones. For example, psoriasis, a common skin condition we see, can look almost purple in darker skin tones, versus lighter skin tones we tend to see more pink or red. Also in dermatology textbooks, they tend to feature a lot of skin conditions seen in lighter skin tones. So when we see the same conditions in darker skin tones, it can be pretty easily misdiagnosed.
Okay. So can you explain how skin tone and melanin levels affect the way skin reacts to chronic skin conditions like acne and eczema?
Yeah, so in darker skin tones, when there's any sort of inflammation, it can leave the post-inflammatory hyperpigmentation. So basically, it triggers increased melanin production. And in darker skin tones, these dark marks can last for months to years. And it's one of the most frustrating side effects that patients with skin of color tend to deal with.
I mean, I can personally speak to that. I have a darker skin tone. Yeah. I have eczema. And you're right. We do get like these dark rash circles all over our body. And it's not pleasant.
Yeah, and in addition to the dark marks, a lot of light marks can happen depending on different treatments we use. For example, liquid nitrogen can harm the pigment producing cells on the skin, and that can leave light marks that may be pretty difficult to fix. And then in darker skin, patients can be more predisposed to scar formation and keloid formation. So even after certain acne outbreaks, you can have scars that extend beyond the original injury, and those are also very difficult to treat. So before any sort of skin surgery, it's also important to discuss a history of scarring in the past too.
So what are some of the most common misconceptions about darker skin tones?
So some of the more common misconceptions is that darker skin tones don't need to use sunscreen. This isn't true. Darker skin tones, even though they have more melanin or pigment in the skin, which can be a little more protected from the sun, it's still susceptible to damage from UV light. UV light comes from the sun, and it can go deeper into the skin and cause premature aging, as well as increased risk of skin cancer. And the second most common misconception is that darker skin tones don't get skin cancer. That isn't true. Darker skin tones can definitely get skin cancer.
Skin cancer doesn't always get talked about in the context of darker skin tones, and I can speak personally being a part of this community. So what should our viewers know?
So skin cancer can definitely happen in darker skin tones. I've commonly seen different types in different locations when compared to lighter skin tones. For example, I've seen pigmented basal cell carcinomas. They tend to look a little more different than the typical pink or pearly spots that we see on lighter skin. And also melanomas can happen too. And the most common type of melanoma in skin of color is called acral lentiginous melanoma. And these tend to happen more on the palms, soles, and it can also happen on the nail unit, which can look kind of scary. In addition, squamous cell carcinomas are a different type of skin cancer, and that can occur in the groin in patients who have a history of human papillomavirus, and also in patients who are on immunosuppressive medications. So for example, in patients who have chronic autoimmune conditions or are post-organ transplant, those patients should definitely see a dermatologist for skin checks to screen for skin cancer.
Wow, okay. This is a lot of great information. Now, what's the one thing you wish everyone understood about caring for their skin and their skin tone?
Sunscreen is the key to prevent premature aging, as well as help against UV damage and preventing skin cancer. So if there's only one thing you can do every day for your skin, it's sun protection.
Wow. Just as simple as that.
Yep, just as simple as that.
Well, Dr. Christina Sun from Dermatology Partners, thank you so much for being here with us today on Philly Live. And to schedule an appointment, visit dermpartners.com or call 888-818-DERM today.